Now, finally, we will conclude the theme of weight loss today with a podcast on bariatric surgery. So, as I mentioned in earlier podcasts, weight loss is an important part of general practice, but it's not something that we are overly familiar with, as most areas will have local weight services which are easily signposted to for patients. So for this scenario, I would like you to consider, when would bariatric surgery be recommended as a treatment option? And also, when would bariatric surgery be the option before lifestyle and drug treatment? So bariatric surgery is recommended as a treatment option if all of the following criteria are fulfilled. So firstly, the patient or person has a body mass index of 40 or more, or they have a body mass index of between 35 and 40, but then have other significant diseases which could be improved had they lost weight. So these are your standard kind of type 2 diabetes, hypertension, dyslipidemia, severe mobility problems, etc. Now, in addition to this, all appropriate non-surgical measures have been tried, but the person has not achieved or maintained clinically beneficial weight loss. Okay, and then you also have to have that the person has been receiving or will receive intensive management in a tier 3 service. So we'll come to what tier 3 services are shortly. The person has to be generally fit for anesthesia and surgery, so that can often be an anesthetic opinion rather than our opinion. And then the patient commits to the need for long-term follow-up once they've had bariatric surgery. And in addition to this, the second question that we were asked was with regards to when would it be first choice, and it's first choice before lifestyle and drug intervention if a patient has a BMI of more than 50. Now, one final point that I also want to make is around what happens with bariatric surgery where you have a person who has recent onset type 2 diabetes. Now, the guidance from NICE CKS would suggest that a recent onset diabetes is actually within a 10-year time frame. So as we know with diabetes, it has such an impact on healthcare, it has such an impact on people's lives that the guidance is often less stringent in terms of who can then be offered bariatric surgery. So if a BMI is 35 or more, then you can actually offer expedited assessment for bariatric surgery as long as the person is also receiving this specialist assessment in a tier 3 service. So I will explain tier 3 service right at the end of this podcast. Again, if the BMI is between 30 to 35, then you can actually still consider bariatric surgery for a new onset of type 2 diabetes, as long as, again, they're within a tier 3 service. And finally, one of the things to remember, which is something that I'm personally at risk of, is if somebody comes from an Asian family origin, then consider the assessment for bariatric surgery at a much lower BMI than other populations, because actually they are at risk with much lower BMIs than what somebody who's not from an Asian family origin would be. Again, they have to be within a tier 3 service for this to happen. So what is this mysterious tier 3 service that I've been talking about? Well, a tier 3 service is a service which is led by a local CCG, which is a clinician-led multidisciplinary team. So this includes a physician, so that can either be a consultant, or a GP that has a specialist interest in weight loss management services. There must be a specialist nurse, a specialist dietitian, a psychologist, a psychiatrist, and a physiotherapist. So it's a multidisciplinary team which all has this primary goal of helping patients lose weight. So I hope you found this interesting. I hope you've enjoyed this theme around weight loss. And if you want to hear these application scenarios and hear me go into much more detail, so that's over 200 scenarios, 200 scenarios, then do check out the best AKT mock course, which is available on wellmedic.co.uk, and please do share these podcast episodes with your GP training colleagues. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.